Hi, I'm Dr. Seth Hosmer, and I'm here at Hosmer Chiropractic Health. And what I wanted to go through today is to show you how to do one of the low back and hip exercises that we have many of our patients do. What we're going to show today is how to mobilize the SI joint. So the first question most people have is, what is the SI joint and where is it? So what we're talking about is this joint right in through here. Looking from the back, it's where this bone and this bone articulate. There's a joint in through there. We want some motion in that joint. If it's not moving well, then it will oftentimes cause pain right at the junction of the spine or into the low back, sometimes down into the hip, around the side of the hip. And so an important way to relieve that after you've had your treatment is to be able to maintain this, the SI joints at home. And so what we do with this is we're going to show how to use a foam roller right on top of that joint right here to mobilize your SI joint and get that moving. So the way that this works is, first of all, you need a foam roller that is relatively firm. If the roller that you've got has divots in it when you're done, the roller is not hard enough to get effective pressure on the joint. So the way that we're going to set this up, we're going to take our roller, start with this, start on your back. We're going to have the roller underneath your knees. Then we're going to bridge your hips up, move the roller so that it is underneath your SI joints. You're going to want to check if you're in the right spot by feeling for the muscles of your low back where those end, right at your hips. You should feel the bones of your SI joints, and that's basically where you want to place the roller. So what we're going to do next is have a relatively wide stance with the legs. We want to have plenty of space between your feet. Then we're going to drop the right knee out to the right side. That makes us load up the right SI joint. I'm keeping my left leg fixed. I do not want to roll my whole body over to the side because we're not going to get pressure on the right spot. So we're going to drop just the right knee out slowly. We don't want to go quickly with this. We want to give time for the joint to move. Then we're going to bring the right leg back up, and then we're going to take the left leg, and the left leg goes out to the side. We're only rolling just far enough that we load the one side and unload the other side enough that I could slip a piece of paper back there. We are not rolling all the way over. So we're going to do between 5 and 10 slow rolls from one side to the other. I like to tell patients that we are doing this glacially slow. We don't want any speed at all when we're doing this. And then what we're trying to do with this first part here is we're trying to assess whether we have a different side. And what we're looking for with that difference is that on the healthy side, you should feel your joint just sort of squish out of the way, and the roller should just feel kind of neutral. On the bad side, or the stiff side, what we're going to feel is that the roller feels harder on that side, or like you're getting more pressure from the roller on that side. And then that's the side that we want to treat. And so in order to do a treatment on this, after we've done our passes back and forth, say my left side is the tight side, I'm going to just stay on the roller on this side for a minimum of 30 seconds, but as much as maybe 2 or 3 minutes. And what we're looking for is that initial soreness that we feel on the roller, for that to dissipate and decrease, telling us that we've gotten some motion back into the joint. So I'll just stay in this position. Another thing that we'll do if we feel like we need more pressure on this side is we're going to do a figure 4 with our left leg. So I'm treating the left joint here. I'm going to bring my right leg into midline of my body. I'm going to bring my left ankle up on top of my knee, so I'm in a figure 4 with this leg, and that allows me to be a little bit more precise in my positioning of the roller under that SI joint. And I usually like to move my feet a little bit towards the side I'm treating, pick my head up and move my shoulders over a bit to the right, and that puts the foam roller a little bit more square with the joint, so it's lined up like this instead of off to the side. Then I'm going to hunt around a little bit for whatever part feels like it's the tightest, and I'm just going to wait here for things to relax. Again, 30 seconds is the minimum, but we're looking for up around maybe 2 or even 3 minutes if it's especially stiff. So once we're done with that joint mobilization, we're going to bring the legs back down, and we want to make sure that we do a quick stretch in the other direction. So we're going to take one knee, bring that knee up, other knee comes up, and we're going to do a brief knees to chest stretch. 2 or 3 breaths here is all that it takes to help loosen the back up in the other direction. Then one knee at a time back down, bridge the hips up, roll the roller out, and you're finished. So as with all rehab type things, you want to be gentle with this when you're first starting. If you have any questions about how this is working for you or whether it's appropriate for you, please talk with your healthcare provider. But we found this to be a safe and healthy way to help to stretch and mobilize those SI joints. Enjoy.